Hello everyone and welcome to the first of 3 videos for our Pediatric Cardiac Week. In this video we'll do a brief introduction and then talk about CHF. It's important to remember the anatomy of the circulatory system for several reasons. The first is that when the pump isn't working well, depending on what's going on, it tends to back up into the nearest organ. You'll see that most of the time in the lungs for pulmonary edema, or in the liver with hepatomegaly. But also remember that we have shunting and different pressures as well. So anything blue on this picture is a low pressure system. Anything red on this picture is a high pressure system. If we created a channel between the two of them, the high pressure would push more into the lower pressure. And we'll talk about that here in a moment. Just a few key things I want to review about your physical assessment of the child with cardiac problems. Remember, you need good cardiac output to gain weight and grow. Cyanosis can be present in several of the congenital heart defects that we'll talk about, but anybody who has poor perfusion can look pale or even cyanotic. Remember to palpate for hepato or splenomegaly. These can be very telling in certain cardiac conditions. In addition, you want to check your pulses. Not only do you want to know the heart rate, but you also want to know the strength of the pulses. When you're listening to the patient's heart, we want to know how fast it is, but also we want to know, is it clear or muffled? Or are there any murmurs or additional heart sounds? Some of the additional diagnostics that we haven't already talked about would be ECGs, also called EKGs, echocardiography, which you'll get to see in class, and things like cardiac catheterization that we'll talk here in a moment. Cardiac catheterization in pediatrics is very similar to cardiac cathing in adults. We can enter the femoral artery or femoral vein in children, and then with fluoroscopy, we can guide the catheter up and take pictures of the heart. We can also inject contrast or perform certain procedures. There are complications that you need to look for as the bedside nurse after a cardiac catheterization. Acute hemorrhage from the site would be the most obvious. However, it's not unusual to have a slightly less strong pulse in the extremity that we use the artery for during the cath. However, this should be transient. Also transient are some dysrhythmias. After a cardiac catheterization, you'd want to be checking pulses distal to the catheterization site. You'd also be checking for other signs of perfusion, like temperature and color. As with any procedure, we would be doing frequent vital signs when the patient initially came back, as well as closely monitoring the dressing for evidence of bleeding or hematoma. Let's talk a little bit about congestive heart failure. Basically, all heart failure means is that your body cannot use your heart well enough to supply enough oxygen to meet its demands. There are many etiologies for heart failure in pediatrics. Structural abnormalities, such as the congenital heart defects we'll talk about in the next presentation, are fairly common. However, you can also see cardiomyopathies, dysrhythmias, or even severe electrolyte imbalances. Even something like sepsis or severe anemia can result in heart failure. You'll see that classically heart failure is separated into 2 categories. right-sided, and left-sided. However, in pediatrics, you'll likely see a blend of symptoms from both. As I've told you before, I'm more of a visual learner myself, so I really like this flow chart, which talks about and lists all of the signs and symptoms of heart failure and some of the problems that we see. The signs and symptoms of heart failure can broadly be divided into three groups: impaired myocardial function, pulmonary congestion, or systemic venous congestion. Let's talk about these separately. Impaired myocardial function, or just basically your heart muscle is not working. You can see things like tachycardia, sweating, particularly with anything that's causing the child or infant to work harder, such as an infant who's trying to feed. Fatigue, weakness, and everything else listed on this slide. In pulmonary congestion, you can see tachypnea, retractions, exercise intolerance, and you can hear wheezing or crackles. With systemic venous congestion, the child is likely not eliminating the edema, so they'll be gaining weight. As we saw in the picture when we started this presentation, they may have hepatomegaly from back up into their liver. They may also have abdominal distension and ascites. The diagnosis of heart failure is made based on the clinical symptoms as well as the imaging that we obtain. It is not unusual when we are thinking that a child is in heart failure to do a thorough history and physical exam, get an EKG, a chest x-ray, and an echocardiogram. In addition, we'll also obtain labs like the BRNP or BNP. And broadly, the goals for treatment of heart failure include making your heart work better, getting rid of the accumulated edema, decreasing how hard your heart needs to work, and improving tissue oxygenation. Let's talk about these separately as well. There are three groups of drugs that we can use to improve cardiac function: digitalis, ACE inhibitors, and beta blockers. The first category make the heart contract more efficiently. The second category reduces the resistance the heart has to pump against. And the third category slows the heart down so it has more time to do a thorough job of pumping. There are several important things to know about digoxin. The first are the beneficial effects that we're looking for, which include improved cardiac output, decreased venous pressure, and relief of the edema. Serum potassium levels have a very drastic effect on digoxin. Therefore, we have to monitor these potassium levels carefully, and having a normal potassium level is what we want for the child on digoxin. Remember that there is a very narrow therapeutic window for digoxin. As the nurse, you'll want to make sure that you're giving the correct dosage and observe for signs of toxicity. You would check the apical pulse for a full minute and make sure you know your hold orders for your medication. Common signs and symptoms of digoxin toxicity include nausea, vomiting, anorexia, bradycardia, and dysrhythmias. The second broad category that we mentioned was removal of accumulated fluid and sodium. We typically accomplish this with fluid restriction, which includes sodium restriction, and the use of diuretics. You'll often see children with complex heart disease on Lasix, diuryl, and aldactone because they work in different areas of the nephron. Remember, any diuretic that has an effect on electrolytes means that we need to monitor those electrolytes and sometimes give supplementation. We also said we wanted to decrease the cardiac demands. In order to do this, we would reduce anything that you think would cause stress on the body. This includes preventing fevers, but also preventing cold for infants. We want to treat or prevent infections. We want to make sure that the child can breathe comfortably. Sometimes this means using positive pressure to help. We also want to keep them calm. Sometimes we use sedating medicines for that. And provide rest in an environment that has decreased stimuli. By decreasing the oxygen demand, there will be more oxygen available for the tissues. However, remember, we also provide supplemental oxygen as needed. As the nurse taking care of a pediatric patient with heart failure, you would want to watch their eyes and nose carefully. You would want to perform daily weights using the same scale. Monitor them for signs of dehydration, but also for fluid overload. Sometimes children outgrow their diuretic doses. In addition, you want to watch for any signs of electrolyte imbalances. Like we said a few slides ago, we want to make sure that we're not causing too much stress on the child's body, which would increase their metabolic or oxygen demand. Infants with heart failure can tire very easily with common activities such as feedings. Therefore, we'll offer them smaller and more frequent feedings. We'll also pace them during the feedings, allowing them to take breaks, and limit each feed attempt to only 30 minutes per session. Remember some of your basic nursing care as well. For example, for the child who has any form of respiratory sequelae from heart failure, you would want to elevate their head of bed.